Hello, hi, good evening everyone. Welcome back to another OET Speaking Speculation Live. This is me, 𝐎𝐤𝐞𝐚 𝐤𝐴 joining you from Neethu's Academy. So yes, welcome back all of you. Good evening everyone. So let's just wait for others to join and then we will quickly start with today's discussion. Today also I am here with another recent exam model card pattern for you to work out. So make sure that you're taking a screenshot of these cards that we discuss in all the lives and to practice it in your own time. Make sure you try it at least twice, okay, and see whether you notice any improvements or whether you can construct the statements after the discussions, because after the discussion you will definitely have an idea about what to be done and how the sentences should be performed and said. So based on that you can do the needful. So yes, good evening. Yes, good evening Adira, good evening. Okay, so today we are going to look into a card which is an emergency department setting, and when you look through the background information you can see that you are talking to the parent of a 5-year-old child in the emergency department. The child fell while playing and hit his head on the playground equipment. The child is present but not participating in the conversation, and your first task is find out the reason for the child's visit to emergency department. So this is the card. I'm going to give you 3 minutes to prepare it right now. So go through the card, take your time to read and make sure that you prepare everything, and then we will start with the discussion. Okay, you have 3 minutes. Alright everyone, welcome back. So I hope you got an idea about how this card can be done and you have prepared the points. You have noted down each and everything that you require to do this card. So always remember there are 8 points that you need to prepare while you are looking into a card during the 3 minutes. And those 8 points are nothing but your introduction, initial assurance, the action verbs and the expansions, the keywords and the expansions or the synonyms for that, how to end each task, the transition to the next task, and you need to plan which words are the reassuring points, the sentences, the vocabulary that you need to use in which places and everything, and lastly the conclusion. So if you have these 8 points prepared well, that means you are still ready to have a proper presentation. You will have an idea about how to do it and how to well execute it. Okay, so now looking into this card, you can see it is given as the emergency department, and when you read through the context, you can see that you're seeing the parent of a 5-year-old child in the emergency department. The child fell while playing and hit his head on the playground equipment. The child is present but not participating in the conversation. So from this information, you got an overall picture about what kind of context you are dealing with. So the first thing that comes to your mind is, okay, yes, this is going to be an unknown case because it is emergency department. Not just because of that, also because it is nowhere mentioned you examine the child, or this is a follow-up, or the doctor advised you to do this, or this is kind of like a review or anything like that is not mentioned here. So we can come to the conclusion this is an unknown case for sure. No doubts, no clarity is required. That is absolutely clear. Now, we need to always check your first task to confirm whether it is an unknown case or not. All the time you have to make sure that you always check your first task also to get an idea or to confirm whether this is a known case or unknown case. Okay, now your first task is find out the reason for the child's visit to the emergency department. So whenever you ask the question, find out the reason, that means this is an unknown case because you have no idea why this person is here or what is the reason behind this person's visit. So in the cases വരുമ്പോൾ എന്തായിരിക്കും unknown case ആയിരിക്കും. അതിൽ നിങ്ങൾ ഒരുപാട് കൺഫ്യൂസ്ഡ് ആവേണ്ട ആവശ്യമൊന്നുമില്ല. It's pretty simple, pretty direct. The only context and condition is the first task is asking you to find out why this person is here. That means it is going to be an unknown case. Now, from this particular information, so far we understood this is an unknown case. So, let's look into the introduction. So, for an unknown case, you will start with the greeting. Then you will get into the self-intro. And after that, you can collect the patient details. And in this case, the bystander information too. And after that, you will provide an initial assurance. That means you will offer help. And then you will proceed with your tasks. This is the idea of your introduction for unknown case settings. So let's have a look into the introduction. So if I was the candidate, this is how I would be doing it, okay? Hello, good evening. My name is Richa. I'm one of the registered nurses working in this emergency department. May I know your name and details, please? Yes, my name is Thomas and I'm here with my child. Alright, could you please help me with your child's name and age? My son's name is Roy and he is 5 years old. Okay, so tell me, Thomas, how can I help you today? Oh, I'm really sorry to hear that Roy had a fall recently, and don't worry, I understand you're really concerned about it, but don't worry, you are in the right place. I will definitely do the needful. But before proceeding further, I would like to ask you some questions about the fall and also regarding the physical effects of the fall on your child. May I? So this is how I would be doing it. Now, if you have noticed, I did task number 1 and then I moved on to this point. It was a very direct approach. So what I said is, don't worry, I understand that. But before we proceed further, so the only connection I did in between these 2 tasks, that means task number 1 and task number 2. The between portion is I connected by saying before proceeding any further. Before proceeding further, I would like to ask you some questions about the fall. You can see the word elicit. What do you mean by elicit? Elicit means ask, find out, etc. Okay, no? Gather, collect, ask. ഇതൊക്കെയാണ് എലിസിറ്റിൻ്റെ മീനിങ്. അവരെ കൊണ്ട് ആ ഇൻഫർമേഷൻ അവരിൽ നിന്ന് മനസ്സിലാക്കി എടുക്കുക. So ask, find out, anything can be used as a synonym for the word elicit. So here I'm going to expand that into I would like to ask you. Okay, I would like to ask you more details about the fall and also about the physical effects on your child. About, I'm changing that any into about, and physical effects on the child. Okay, physical effects on the child. So instead of on the child, if I want, I can also ask physical effects of the fall, on, instead of the, I can say on your child, or you can use the name of the boy as well. Okay, so that is how we can construct a statement there. So I hope it's clear to you guys. So let's have a look at that task one more time. So all of you focus when I'm constructing the statement. Okay, so I would like to ask more details about the fall and also about the physical effects on your child. May I? Simple as that. And then you are moving to the next point. First is location, then you have nature of the fall, how he or she landed, any loss of consciousness, nausea, vomiting, dizziness, headache, etc. So I'm going to break it down and ask the questions. Where did it happen? First one is location. So how would I ask location? Where did it happen? Or where did he fall? Where did it happen? Where did he fall? Etc. could be fine. The next one is nature of the fall. Simply what you can do is, you can just try this. Okay, could you please tell me about the nature of the fall. Could you please tell me about the nature of the fall? Then the next one is how he landed or how she landed. Okay, then after this question you can simply start like this. And how did she landed? How did she landed? This is another point. Then you have any loss of consciousness. You can ask the question, did she lose her or his, based on the gender of the baby. So in this case it is a boy, so because the name was Roy, so lose his consciousness after the fall. And the next one is nausea, vomiting, dizziness, headache, etc. Did he exhibit or show any symptoms such as nausea, vomiting, dizziness, or headache? This is how you will ask all these questions. I hope it's clear to you guys. Take a note of the way the questions are framed. So after you finish asking all these questions, you will give a very small summary. Okay, so let's see how the summary can be given here. So imagine you got these answers: location, park, nature of the fall, sudden, intense fall, how she landed on his back and hit his head. his head. This is the information for that. Any loss of consciousness? No. Any other symptoms? No. Okay, so these are the information. So based on this, I'm going to show a summary, so please look into it. Thank you for answering all my questions. From what you told me, I understand that Roy was playing in the park and suddenly he fell down. The fall was very sudden and intense, and he landed on his back and hit his head. He did not lose his consciousness and he did not show any signs of nausea, vomiting, dizziness or headache after the fall. Am I right? This is how we can construct a statement as a summary after asking all these questions. Okay, so I hope it's clear to you guys. Now let's have a look at the next one. So the next one is explain the next steps. A physical examination needed, checking vital signs, the doctor's assessment, etc. Find out any concerns or questions. So for this task, this particular portion, explain the next step, is a very common exam task. Okay, you can expect this particular task mostly in almost all the exam cards. So let's see how you can expand it. So for next steps, you can always try this. I would like to take you through what's going to happen next. I would like to take you through what's going to happen next. This is one sentence, or if you want to keep it very short, you can say, as for the next steps. Okay, or you can say, speaking of the next steps, speaking of the next step or steps. Okay, so these are all different ways of expanding. Explain the next steps, or I will tell you what is the next step. I'll tell you what we are going to do next. All these sentences can be tried. Okay, now let's see how the sentence can be constructed. So I will highlight it as and when I am constructing the statement. I would like to take you through what we are going to do next. We need to carry out a physical examination of your child. We'll be checking the vital signs and the doctor will come and assess your child. So I hope it is clear to you. Do you have any questions or concerns? This is how I'll do that. Okay, let me take you through that one more time. So please look at the highlighted portion as and when I'm constructing the statement. I would like to take you through the next steps. We will start with a physical examination. We'll check the vital signs, and after that the doctor will come to assess your child. I hope you understand. Do you have any questions or concerns? This is how we will do that. Okay, so pretty simple, pretty direct. Now the next point is resist giving waiting time. So resist is also a very common action verb that you can see in your exam cards, which means deny. In this context, okay, this is a contextual meaning, not a literal meaning. So contextual meaning is this, deny. Now deny in this context means you have to politely say no. You have politely say no. So let's see how we are going to politely say the patient or tell the patient. We can't talk about the waiting time, or the waiting time totally depends on the priority of cases and the availability of doctors. Okay, so now let's see how the sentence can be constructed. So first what you need is, whenever you're resisting, you need acknowledgement first, and then you need to resist, and then you need to assure. Okay, so it is like this. I understand that you're really concerned about your child at the moment, but unfortunately I won't be able to tell you up on an exact waiting time, because it totally depends on the priority of the cases and the availability of doctors. But please don't worry, we will be looking into your child. We are monitoring him, so don't worry about it. So this is how I'll be doing that task. Now Look at the next point. This is what I was waiting to explain when I picked out this card to discuss today. This point is talking about reassuring the parent about the child's present condition, appears alert, responsive, no obvious signs of serious injury. So you can only do this point after examination. You need this point here, but it is not given in the card to examine the patient. This is called hidden task. What is it called? It is called hidden tasks. So sometimes there would be some tasks which will be hidden, which will not be given there, but to maintain the flow of conversation, it would be vital, or it is necessary that you do this hidden task in the role play, so that the flow of conversation will not be tampered and you can speak very naturally. So in this case, once you finish this particular point, resist the point, not this one, resisting availability of the doctors and etc. What you need to do is, you need to tell, so can I please examine your child? You need to ask this question. So when you ask that question, the parent will be like, yeah, it's okay. Then you will be quickly examining your child and you can say, thank you for your cooperation. So based on my examination, I can assure you that your child's present condition seems normal. He appears to be alert and responsive and there are no obvious signs of serious injury. So please do not worry about it. This is how you can do that. I hope you understood. Okay. So you just need to add on the point of examining here. If examination add ചെയ്ത് കഴിഞ്ഞാൽ automatically you can be taken to the next point. So let me show you that one more time. So I'm starting from this point. I totally understand that you're really concerned about your child, but let me assure you that, not let me assure, I understand that you're really concerned about your child, but unfortunately I won't be able to tell you about the exact waiting time. It depends on the priority of cases and the availability of doctors. But please don't worry, we will be monitoring your child. So having said that, can I please examine your boy? Thank you for your cooperation. So based on my examination, I can assure you that your child's present condition is perfectly all right. He appears to be alert and responsive and he doesn't have any obvious signs of serious injury. So there is nothing for you to be worried about. Please be relaxed. So is there anything else I can help you with at the moment? So this is how you will be doing that task. I hope you got an idea about how to present it. Now once you do that, the next point is emphasize the importance of monitoring the child at home. So they just like, okay, when you ask the question, do you have any concerns here? Definitely the mother will be asking a question. Yeah. So this has become like a routine thing. He's a very active kid. He plays and sometimes he trips, sometimes he falls down. So is there any advice you can give me to prevent any such kind of problems or such kind of incidents in the future? So you're going to emphasize importance of monitoring the child at home. So here one point you need to notice is you're talking to a mother or a father here. So telling a mother or a father to be more careful at home is kind of like a problematic area, because it would sound like that you are questioning their parenting and you are saying like you are not satisfied with the way you're looking your child right now, you need to be more careful. Like, no parent would like that. So when you frame that sentence, you need to be very careful about it, and you need to be creating that sentence in a way that is not making them feel offended. So it has to be more sensitive. So you can start one sentence with a little bit of a sugar coating statement like, there is no doubt that you are a great parent. Okay, there is no doubt that you're a great parent. However, children of this age, they need extra care. So please make sure that you monitor your child at home a little more. You make sure that you monitor your child at home a little more. Please watch for any changes in the behavior of your child. And in case if he has any increased drowsiness, vomiting or headache, please make sure that you bring him to the hospital immediately. And also it is important that you come to the hospital if the condition worsen or if we start to experience any fever. So this is how we can construct that sentence. So make sure whenever you are talking to a concerned parent, your sentences are constructed in a way which has a lot of reassuring points, and your sentences need to be sensitive as well. So this is an important point that has to be noted. Now once you finish the entire point, you can wind up the entire conversation by asking, so is there anything else I can help you with? like? Do you have any other concerns? So the parent says, no, I don't have any other concerns. So you can say, well, I understand that you are a little concerned about your child as a whole, but please don't worry. As I told you, he is perfectly fine and we are monitoring your child at the moment. The doctor will be here very soon and he will speak further, or he will discuss further details with you. Until then, please wait here. In case of any emergencies, please contact us. Please come to us, okay? Or you can just say, like, we can wind up by saying the doctor will be here very soon. I'll let you know when the doctor is available, okay? All these are different conclusions you can try in this context, okay? So this is the overall presentation of this card. I hope you got a picture about this. Now, these types of concerned bystander cases are a repeated kind of question when it comes to your examination. You can expect these types of questions most often, so make sure that you practice these types of questions as well, especially the keywords, the action words that you can see in each of the questions. For example, in this particular task, you can see the word elicit, then you can see the word resist, emphasize. So these types of words are not common, but at the same time I have repeatedly seen it for the exam cards, but it is not very common when you're practicing. So make sure that you have some go-to statements already ready for these types of tasks. It is important that you have something ready, okay? So these things, when you already know, okay, if this is my task, this is the reason, this is the way I'm going to expand it, or if this is my action verb means these words, okay? For those who don't know, these are the action verbs. So if you already have an idea about what is going to be your action verb, and if this is my action verb, this is my go-to statement, so if you're planned like that, you will not feel hesitant, you will not be stuck, you will be very natural and you will be very spontaneous to speak as well. So try that. Okay, it's because as a whole, the entire conversation has to sound very fluent. It has to be spontaneous. It has to be very natural as well. So make sure that you always keep in mind to have a beautiful flow of conversation when you are doing the speaking test. So that is also something that you need to practice on. No matter how many sentences you say, or how many words you have used, or how many vocabulary or idiomatic speech and expressions you have included in the role play, your score will only be increased if the presentation is good. Okay, just because you are saying all these words doesn't mean that you will be getting a good score. In order to get a good score, you need to be having really good presentation strategy. Your sentence structuring need to be good. The way you naturally speak needs to be good. Your fluency has to be improved. So in order to improve all these things, you need constant practice as well. So always remember to speak every day on a regular basis. And whenever you see the live segments and you take the card, sit down with the card, spend some time to look into the card, break it down, understand the points, and plan everything. Take that time. Okay, maybe take 30 minutes to prepare the card. Okay, because the more you spend the time to prepare the card on the initial days, when you understand the structure properly, eventually you can stop giving a lot of time for the preparation, because you will be reaching a point where you know all the strategies, you know all the patterns, and you all know all the formats. So you can just simply look into the card and you'll be like, okay, this is here, so I can speak like this. If this is this task, then I can construct the statement like this. So naturally you will reach a level where you can do that. But in order to reach that level, it is important that you spend some time to understand the card. Okay, I'm not talking about the 3 minutes preparation time. Sit with the card for maybe like 10 minutes or 15 minutes or 30 minutes for that matter. Look into it, understand each and every single part of it. Okay, what is the structure here, how they have constructed the task, the transition points, the words they have used in each of the tasks, the repetition of the action verbs, the repetition of the pattern, and the nature of the tasks and everything. So when you know this, you will be very familiar with the concept, and it will get more easier for you to speak as well. And trust me, when you go for the exam and when you see a task or a card which is very familiar to you, or maybe not the topic, I'm not talking about the topic, I'm talking about the pattern. So if the pattern is very clear and familiar to you, you would feel that confidence dripping to you, and you will be like, okay, I know this, I can do it, because I have been practicing tasks and cards with these types of sentences and words in it. So I have no issue in constructing a statement for this particular card. So when you feel that confident, that will be visibly reflecting in your presentation as well. So you can speak very beautifully, very naturally, and you can get a better score as well. So make sure that you do that. Okay, so more time that you spend for your preparation during your practice times, that means that your performance will also increase. Okay, the quality will increase, the presentation style will be enhanced and things like that. Okay, so make sure that you analyze the card, spend more time for that, and then set the timer for 5 minutes and do it. And gradually you can reduce the longer preparation times to 3 minutes as well. So in the beginning days, or in the day 1, day 2, like say for example, if you are a fresher, this is a strategy that you can easily start right now. So make sure that you try to follow these strategies and see the changes. Okay, so now coming back to this card, I hope all of you got a picture about how this card can be done and how it is delivered. So I hope everything is clear. If you have any further questions, feel free to comment down in the comment box. I will look into the comments and definitely get back. And if you have any cards in your mind about any particular topic that needs an explanation, or that you would like to discuss in the live segments, please post that comment, that topic in the comment section. I'll definitely consider that for the next live as well. Okay, so that's all for today, guys. I'll be coming back next Tuesday at the same time, 5:30 p.m. with another card. Until then, take care. Good night, all of you.